There are many factors that can cause adolescent pregnancy. The first factor is lack of parental care. As we know, parents play a very important role during the childhood and also adolescent age of the children. At this age, it is very important for the parents to practice parental discipline and effective communication with their children. However, most parents avoid their child from giving sex education, telling wrong information, and inhibit them from taking part in educational conversation about sex. This lack of education and no guidance regarding sex education are factors that contributed to the adolescent pregnancy. Other than that, lack of parental care because of the absence of parents or being raised by a single parent is also one of the factors. This may be due to the parents busy working and they do not have enough time to spend, to engage, and to listen to their child. Thus, the child feel left behind and lack of love. The parents' lack of supervision to the adolescent's behavior may also be one of the contributing factors. So, the children tend to spend more time and seek outside relationship with their boyfriends, which can lead to sexual activity or zina, and also adolescent pregnancy. Next is the influence of Western culture by the media. In this modern and technological era, social media and mass media such as movies, televisions, music, magazines, and internet have no boundaries and are easily accessible by both children and also adults. The children prefer to spend more time on this platform rather than education in school or also spend time with their parents. These platforms that have contents that glamorize indecent behaviors have indirectly brought the influence of the Western or outside culture that are not appropriate and not suitable with the Muslim lifestyle. The adolescents that have been influenced by the media tend to follow these behaviors into their life because they think that these behaviors are permissible, trendy, and suits the current world. As adolescents are curious and brave to try new things, they will start early dating, spending more time with their partners, and may eventually indulge in sexual activities outside marriage, which finally leads to adolescent pregnancy.
Bismillahirrahmanirrahim. Okay, the next factor of adolescent pregnancy is poverty. Adolescent pregnancy is likely to occur in girls who are poor, lack of education, and lack of ability to make decisions. According to Sinar Harian on 4th March 2019, in Malaysia, the Ministry of Health recorded there were 3,694 pregnant girls aged from 10 to 19 years old in 2017, which approximately 10 cases every day and 300 cases in a month. The poverty and the irresponsible parents from the broken families had caused the adolescent girls to crave for emotional affection and have excessive freedom had caused them want to find the physical and protection from men wish to protect themselves from the unpleasant situation, which later their action may cause them to be pregnant at a younger age. Poverty is the cause of low education status and have problems with manners and behaviors. This factor leads them to mingle with their peers, boyfriends, and playing truants, and also involved in substance abuse such as drug. And some of them were raped, which caused their adolescent pregnancy.
Dating is a relationship which based on love, and basically they tend to act like they are belong to each other. This culture already exists in our community and everyone feel like it is normal. However, in Islam, Allah forbid everything that lead to sin or danger, which in this context is zina. Zina is prohibited as Allah actually want to protect honor and dignity of a Muslim. So, the ways that lead to zina, dating is one of them. Some might tell that they can couple by eliminating the haram acts such as kissing, touching, or involved in sexual desire. However, Why you have to expose yourself to danger? Remember, Allah does not forbid love, but actually Allah already gave the appropriate manner to handle it.
The next factor leading to adolescent pregnancy is peer pressure. This is prone to happen as people at young age are easily influenced by the words or action from people around them. In relationship, there may be an insincere partner. In this scenario, the female partner will be manipulated by the male partner to agree in having sexual intercourse throughout the relationship. Usually, the female partner will be pressured and they are trapped by their partner by saying that having intercourse can be the proof for their love. That is the case for people who are in love. So, how about if they do not have a love relationship? Actually, adolescents may also develop peer pressure by a relationship called friends of benefits. They are pressured to follow the trend of having intercourse between friends without any love or legal relationships. Next, adolescent pregnancy also can happen because the girl herself chooses to marry at a young age and get pregnant rather than continuing their studies. Difficulty in studies is seen to be more common reason that can cause students to drop out from school and get married. In adolescent point of view, it is better to get married if they are unable to pursue their studies. However, such decisions are made without a deep thinking, especially on the consequences of an early marriage, such as the risk of having pregnancy and how to overcome when they already have the child.
Next, what are the impact of adolescent pregnancy to the young girl? Alright, firstly, it will jeopardize the girl's future education and employment opportunities. Women who are pregnant during their adolescence are more likely to face social and economic disadvantages throughout their lives. The young mother tend to not complete their education and drop out from school to be more focused on their pregnancy and take care of their baby after birth. Other than that, they may also be ashamed of their family members, peers, and teachers because they may be criticized as the adolescent pregnancy is opposite to the norm and culture in this society. This will affect their employment opportunities in the future. The women with low educational level are less likely to be employed by the employers because they are lack of skills and knowledge that are required in the industries. They may only be able to earn small wages with unsatisfying job compared to those who completed their study in school.
The next impact of adolescent pregnancy is they have high tendency of having premature birth. The adolescent pregnant have a high tendency of having premature birth or having a baby that lacks of development in their body and brain, trouble with their breathing, and also underweight, which is less than 2.5 kilogram. The premature birth is due to the effects of uterine infections, where the bacterial infections and inflammatory processes have caused the secretion of hormones and other mediators which trigger the uterine contractions for labor pain or rupture of the amniotic membrane ahead of time. Other than that, girls who are pregnant during her adolescent period, they might feel worried and scared to tell anyone about that, and thus causing them to neglect their physical health and try to do abortion by drinking alcohol, smoking, and not get a proper medical care. Next impact is mental illness. Adolescents who are pregnant have a high risk for mental illness, such as depression due to lack of support and rejection from family, peers, partners, and society. The high stigma on adolescent pregnancy in society has caused the adolescent face problems of shame, guilt, anger, denial, and depression, which can lead to feelings of low self-esteem and isolate themselves from seeking help from family, friends, or anyone.
Next, the impact from adolescent pregnancy is the unsafe abortion. So, what is unsafe abortion? Unsafe abortion is the abortion procedure that involves either practitioners that are lacking in skills or the environment itself that did not meet the medical standards. This situation has high risk of maternal mortality. Even if the mother survives after the abortion, she might suffer from a long term of health complications. However, most adolescents actually acknowledge the risk of consequences from an unsafe abortion, but the risk is taken as they are afraid to face the stigma of an unintended pregnancy, especially as the adolescent's pregnancy is not a custom in Malaysia. Besides that, the community believes that most of the pregnant adolescents are among the ones who are always making troubles and involved in social problems.
Next is about baby dumping. In Malaysia, baby dumping issues become lower as we reach 2020. However, to be better, we have to achieve zero case of baby dumping. This basically related with teen social problem and adolescent pregnancy is one of them. This act happened because of the young teenage girl may be afraid of what she had done. She afraid what kind of reaction or view that community will give to her. So, to cover up the dark history, she willing to abandon her child after an unsafe childbirth. Which, this is something that even worse, either to the mom or to the innocent baby.
In Malaysia, the out-of-wedlock pregnancy that happens among the adolescents are alarmingly worrying. There are few solutions that can be implemented by the parents, society, and the government in order to control these social epidemics. The first solution is sex education by the parents. Parents play important role to teach and provide information about sex education and instill Islamic practices to their children since they are small, so that they will understand the consequences of the indecency and premature sexual activity that are not permissible in Islam. In this context, the parents must become the principal communication consultant and guide related to the issue of sex and sexuality to the child. This will construct the child's mindset and perception about sexuality and can control their behavior. The parents must also educate their child about the Islamic law and let them know that sex outside marriage is a major punishable sin. In Surah Al-A'raf, verse 33, it shows that such indecency and adultery are sinful acts that are prohibited in Islam.
The next solution for adolescent pregnancy is baby hatch. Orphan Care Foundation, the non-government organization that works with the government, established the baby hatches in Malaysia that was opened in 2010. The baby hatches are the place where the mothers or others can drop off the unwanted babies anonymously by offering them for adoption. Baby hatch is a transit point for the baby before placing the child to a new family with a mission. Every child needs a family. There are 12 baby hatches and some of them are operated in collaboration with KPJ Hospital in Malaysia, which are each 2 in Selangor and Johor, 1 in Perak, 1 in Wilayah Persekutuan, Negeri Sembilan, Penang, Kelantan, Pahang, Sabah and Sarawak. The hatches are air-conditioned, safe and have 24-hour CCTV inside where it does not identify the mother, and from the CCTV, the caretaker is notified when the baby is deposited in the hatch. Since 2010, the total of babies have been saved by the baby hatches, 420 babies.
As preparation to avoid self from being involved in adolescent pregnancy, adolescents should have been more exposure on the prohibition of zina and anything related to zina. Therefore, they should join more religious classes that might touch on this issue. By learning the topic of zina, teenagers will acknowledge 3 possible punishments for adulterers that have been stated in Quran, which are stoning to death, whipping, and exile. Allah has mentioned about zina together with other 2 biggest sins, which are shirk and murder in Quran. Hence, it is very clear here that zina is one of the biggest sins that we should avoid. From here, the awareness of zina and its consequences can be increased among adolescents, and if they participate in more religious activities and classes, to strengthen the knowledge on prohibition of zina, and we can know the silver linings behind the commandments.
So we move to the next solution. Initiatives to prevent adolescent pregnancy that can be taken by our society are by conducting contraceptive counseling session or having a session in youth program that can deliver more on the prevention steps needed to be taken among sexually active adolescents. The prevention programs are designed to improve the use of contraception devices. Moreover, it is to reduce the number of adolescent pregnancy cases and to avoid sexually transmitted diseases, which is known as STD. So the preventive steps of adolescent pregnancy is vital, as it might give harm to the baby and also to the mother themselves, because there is a greater risk for the teenage mother to have premature birth, low birth weight baby, abnormal baby, and compared to the normal adult pregnancies. So there are several contraceptive methods that can be chosen from. So firstly, the traditional method, which is the male must ensure that the ejaculation process happen only outside from the vagina, so there will be no sperm getting into the female. So this method has around 80% effectiveness. Next, the medication type of birth control, also known as hormonal contraceptives, which consists of progesterone and also estrogen hormone, that works by inhibiting the body's natural hormone that usually can cause pregnancies. This method works to stop the female body from ovulating and provide around 91 to 95% of effectiveness. However, this method needs to be consistently done, as she needs to take the pills daily to keep it functioning. So in addition, the other contraceptive method that can be used is by putting on the barrier devices to avoid the sperm from getting into the female vagina, so there will be no fertilization occur. For male, they are recommended to use condom, as it not only can prevent pregnancy but also to avoid any transmission of sexually transmitted diseases during the sexual activities. So while for females, they can put on the spermicide at the area of their vagina to kill the sperm chemically that are entering the vagina. So therefore, this method could prevent the adolescent pregnancy for the underage teenager.
Lastly, they also can seek help by having a consultation with doctors or general practitioners. As a young teenage girl that have to face an unwanted pregnancy, she for sure need antenatal, childbirth, and also postnatal care. At the same time, she also need emotional support, as she also may be a student that have to face community stigma and also her education struggles. From a consultation with a doctor, it will help them to achieve a better decision. Parents might be disappointed and keep blaming their child. Plus, asking for abortion without thinking their child well-being. With the presence of doctors and practitioners, it will help to keep the tension down and lead a better discussion and understanding. Abortion is come with harmful effects, and it is general practitioners' job to tell about it and also provide possible solution. I think that's all from us. Bye!